Hi everyone, welcome to BDI's next vlog. Today we're going to be talking about MRCP. So this is a globally recognised Royal College postgraduate qualification and it will give you access to GMC registration if you don't want to or are overqualified to go down the PLAB route. We would always say that Royal College qualification is a preferable route to go down because it gives the clinicians in the UK who are reviewing the CVs a benchmark for your clinical skill set. So you'll give yourself an advantage when it comes to having your CV approved and going for interviews. There are 3 Royal College locations for MRCP, London, Edinburgh and Glasgow, and the exam is broken down into 3 parts. So you've got MRCP 1, MRCP 2 and MRCP PACES, and those are the pieces that we're going to be talking about today. Right, MRCP Part 1. So this is your jumping off point for the Royal College qualification and it is made up of 2 3-hour multiple choice questions. So 100 questions, it's best of 5 answers. You get given a clinical question about physical sciences and it will ask you to pick the answer that you feel is most appropriate to the question. So there'll be 5 fake answers, but they'll be usually pretty closely aligned to the real one. The cost for the exam, if you are in the UK, is £419, but if you are applying to do it from overseas, then it's £594 at the moment. Obviously the price has changed, so by the time you see this video, there could be a small fluctuation. So as I say, clinical sciences is the main topic of this exam, and it's broken down into lots of different constituent questions. So you've got clinical sciences, which makes up the majority, so things like immunology, genetics, etc. And then you've got pharmacology and treatments, cardiology, endocrinology, diabetes and metabolic medicine, gastroenterology and hepatology, really testing my memory here, infectious diseases, neurology, renal medicine, respiratory medicine, rheumatology, hematology, psychiatry, geriatrics, dermatology, oncology, ophthalmology and palliative end-of-life care. I think I've covered all of those. So it's quite a broad scope. There's a couple of questions on each area, but clinical sciences is the majority of it. That makes up 25% of that first exam. Okay, so you've cleared part 1. Part 2 is another 2 lots of 3-hour examinations, but these are more like SAQ kind of questions, so short answer questions. There's no multiple choice. The costs to start with are the same as MRCP Part 1, so 419 if you're in the UK and 594 if you're applying from overseas. And again, you've got 100 questions involved in this. So it's going to take what you've learned to pass MRCP 1 and ask you to apply it to some clinical diagnosis. So the questions will have some clinical scenarios and they'll include images, so it could be CTs, MRIs, pathology slides, ECGs, and what they'll ask you to do is prioritize the diagnostic information. How are you going to use that to come up with a treatment plan? What's your sort of short-term problems that you want to solve for the patient? What's the longer-term sort of management that you want to achieve? And then how are you going to assess the prognosis? So you're basically being asked to come up with a full plan of care for a particular patient, given the information that's been provided to you in the exam. So quite a lot more in-depth, whereas MRCP Part 1 is more sort of broad and science-based. Part 2 is starting to hone in on how you would apply that information to diagnosing and treating a patient in real life. Alright, you've completed MRCP 1, you've done MRCP 2, you've probably spent about £1,000 in exams so far, so the bad news is that it doesn't get cheaper. If you're applying for the PACES, the final exam for MRCP in the UK, it's going to cost you £657. If you're applying from overseas, it's going to cost you £1,202. So not a cheap exam, but as I said at the beginning, this is an investment in the opportunity that you have in the UK and your adaptation to working in the NHS, because doctors at an ST3 level or higher who are working within medicine, acute medicine, will be expected to pass this exam as well. So you're sort of investing in your future for the NHS. The PACES exam itself is similar to other Royal College OSCE examinations, so you're going to be into a test centre with lots of actors and invigilators who are observing lots of clinical observations. So there'll be a mix of 5 different clinical stations. Some of those will be observed communications, where you'll be speaking to a patient, explaining about what you're doing, having an interaction with them where they explain to you what their symptoms are, and then you can obviously relay to them what your thoughts are and your opinions for a treatment and a diagnosis. And then there will also be clinical consultations. So you'll be taking a deeper history of the patient, coming up with, again, a sort of detailed treatment plan, which is followed up by a Q&A with the invigilator who is watching you and marking you throughout that process. So this is the part where obviously you've done the sort of 2 writing aspects. You now need to apply this in real life. It will feel like a real life setting. As I say, they'll use actors to be the patients, and somebody will be watching you the whole time. If you've done PLAB or you've revised for the PLAB 2 exam, it will be similar to this in that the layout will have different stations of clinical assessment, but obviously it's going to be much more in depth and much more in tune with specifically acute and general medicine. If you can clear that, then you are well on your way to getting GMC registered, and you give yourself a great chance of getting a job in the NHS. Alright, thank you for watching our vlog on MRCP. I hope you found it useful. If you need more information about what to expect in that exam or support with preparations, then do please get in touch. Equally, if you passed the exam and you're now looking for a job in the UK, please let us know and we can help you with that search. Keep a lookout for the next vlog, and until next time, we'll see you later. Thank you.